Anesthesia. Medicine used to make a patient unconscious or numb during surgery. The patient was given general anesthesia before the procedure. Clamp. A tool used to hold or close blood vessels or tissues. The surgeon used a clamp to stop the bleeding. Defibrillator. A device that delivers electric shocks to restart the heart. The doctor used a defibrillator during the emergency. Electrocautery. A device used to burn tissue or stop bleeding with heat. Electrocautery helped control the bleeding during the operation. Forceps. A surgical tool used for grasping or holding tissues. The nurse handed the forceps to the surgeon. Gloves. Sterile hand coverings to prevent infection during surgery. The nurse handed the surgeon a new pair of gloves. Gown. A sterile garment worn by medical staff in the operating room. The surgeon put on a gown and gloves. Foredrip. A method of delivering fluids or medication directly into the vein. The nurse prepared the foredrip before surgery. Mask. A protective covering for the face to prevent contamination. Everyone must wear a mask inside the operating room. Monitor. A machine that tracks vital signs like heart rate and oxygen levels. The monitor showed a stable heart rate. Operating room. The sterile room where surgeries are performed. Only authorized staff are allowed in the operating room. Operating table. The table where the patient lies during surgery. The nurse adjusted the height of the operating table. Retractor. A tool used to hold back organs or tissues during surgery. The retractor kept the incision open during the operation. Scalpel. A small, sharp knife used for surgeries. The surgeon carefully made an incision with the scalpel. Scissors. Surgical scissors used to cut tissues or sutures. The surgeon requested sharp scissors for the procedure. Specimen container. A container used to store tissues or fluids for testing. The removed tissue was placed in a specimen container. Sterile field. An area kept free from bacteria to prevent infection. The surgical team prepared a sterile field before starting. Suction. A device used to remove blood or fluids from the surgical site. The assistant used suction to clear the area. Sutures. Stitches used to close a wound or incision. The doctor applied sutures to close the cut. Vitals. Essential signs like heartbeat, blood pressure, and breathing. The anesthesiologist monitored the patient's vitals throughout the surgery.